Today we're going to talk about age as it relates to hair loss and hair restoration. If you're wondering if you're a good candidate for hair restoration, chances are that you are. Whether you're in your 20s or your 80s, most people are good candidates. It's just that the approach varies with age. You have to customize it. That's what we do here at Samson. For example, let's take somebody in their 20s. That person may have been experiencing hair loss for just a few years, from their late teens. In that person, the focus, or part of the focus, is prevention of future loss, because they're early in the loss process. So we utilize things such as lasers, which help stimulate blood flow to the scalp and help hold on to hair. We can use Propecia, which helps reduce the circulating levels of DHT. Both of those tactics help stop future loss. Now, then we can go on the offensive, utilizing hair transplants to give a person back permanent hair where that hair is thinning. And in the hair transplantation process, we of course have to consider how much loss they currently have, how much loss they're going to have. And of course we're trying to control that. Compare that to someone in their 40s. The person in their 40s likely has been experiencing hair loss for upwards of 20 years. That person has probably lost most of the hair they're ever going to lose. And we also know the pattern of loss. And this is key, because when we know the pattern of loss, we know the area where they're losing hair, and by definition, we know the area where they're not losing hair. So we know how much hair we have to use in, say, a transplantation process. There we can be much more aggressive in the design of the transplant process, because we do know what resource we have to work with. And our focus isn't so much prevention. So whether you're in your 20s, your 40s, your 60s, or 80s, you're likely a good candidate. It's just that the approach to hair loss has to be customized to age. And that's what we do here at Samson.